Imagine experiencing the worst headache of your life. Sudden, intense, and like a thunderclap. This could be a sign of a life-threatening condition known as subarachnoid hemorrhage. But what exactly is subarachnoid hemorrhage, and why is it so dangerous? Let's dive in. Subarachnoid hemorrhage occurs when bleeding happens in the subarachnoid space, the area between the brain and the thin tissues covering it. The most common cause is atraumatic, a ruptured aneurysm, a weakened blood vessel that bursts. This happens 85% of the time. Trauma, arteriovenous malformations, and sudden bleeding disorders can also lead to subarachnoid hemorrhage. The hallmark symptom of subarachnoid hemorrhage is a sudden, severe headache, often described as a thunderclap headache, an abrupt, excruciating pain that reaches its peak within seconds. Other symptoms include nausea, vomiting, stiff neck, visual problems, seizures, confusion, and even loss of consciousness. If you or someone around you experiences these symptoms, seek emergency medical attention immediately, as time is brain. A CT scan is the fastest and most reliable way to detect subarachnoid hemorrhage. If the CT scan is inconclusive, a lumbar puncture or spinal tap may be done to check for blood in the cerebrospinal fluid. In selected cases, a cerebral angiogram or DSA, digital subtracted angiography, helps identify the exact location of the bleed. Once subarachnoid hemorrhage is confirmed, the priority is stabilizing the patient. Blood pressure control is critical to prevent further bleeding. If it is an aneurysm, that is the cause, neurosurgeons may perform surgical clipping or endovascular coiling to seal the ruptured vessel and to prevent rebleeding. Patients are closely monitored in an ICU setup, as complications such as vasospasm or delayed cerebral ischemia may occur. Vasospasm is a narrowing of the blood vessels, which reduces blood flow to the brain, worsening the patient's condition. The prognosis of subarachnoid hemorrhage depends on the severity of the initial bleed and how quickly treatment is given. Some patients recover well, while others may suffer from long-term complications like memory problems or weakness. Prevention is key. Managing high blood pressure, avoiding smoking, and recognizing early warning signs of aneurysms like smaller sentinel headaches caused by sentinel bleeds can reduce your risk. Subarachnoid hemorrhage is a medical emergency that requires immediate action. Knowing the symptoms, seeking early intervention, and taking preventative steps can save lives. If you found this video helpful, share it with your friends and family, because awareness can make all the difference. Thank you for your attention and have a blessed day.